start by testing this, make sure I'm hearable. It seems like the answer is yes, and hopefully people start filing in from your afternoon break. So thank you, Kelly, for the introduction. And first, I also just want to say thank you both to Kelly and to the Metro Denver chapter of the Oncology Nursing Society for inviting us to speak today. My name is Kasey Bowden. I'm the medical director of the Care Clinic at the University of Colorado Cancer Center. And I'm super excited to be here to speak with all of you today about our Care Clinic. While I'm a nurse practitioner by background, this is my first chance actually to speak at a nursing conference. So I spent some time prior to this lecture trying to get a greater understanding of what people want to hear, but we would love to get feedback from you of what you enjoy, what you'd like to hear more of, if there's anything else that we can offer from our area of expertise, which is we'll talk more about. So for starters, we have no disclosures or conflict of interest. Our objectives for today, first we want to identify current gaps in healthcare delivery systems for patients receiving cancer care. We want to describe a clinical model to reduce costs, reduce preventable acute care, and to improve patient-reported outcomes in cancer care. And last, we want to discuss the Care Clinic philosophy and approach to patient care, including factors lending to staff retention and satisfaction. My hope is that nurses take away today opportunities that you have as leaders to improve overall healthcare systems and can actually see some of the tangible impacts that those can have on patients, because it is my incredibly biased belief, but I also think a belief that's backed in data, that that's what we've been able to do in Care Clinic. And just as another side note, I'm ironically more nervous because we have so many Care Clinic nurses here today, but our staff is just so wonderful. And so also after the presentation, basically anybody in this front row, if you have other questions on Care Clinic, you can also reach out to them.
Including Kelly, yes.
Including Kelly. Okay, so I know you've spent the entire day hearing about current updates in cancer care from some of the most brilliant scientists that I have had the opportunity to work with, and many that I haven't. The argument that I will make today is that when it comes to cancer, the science has outpaced the system. And I'm going to go a little bit more into what I mean by that and how we can bridge that gap. So as a little bit of background, we're succeeding in many ways when it comes to cancer care. Our overall death rate from cancer in the United States has declined by 29% from 1991 to 2017. Now, in spite of the overall decline in death rates, there is still an overall increase in both new diagnoses of cancer cases and in overall cancer deaths. This is because of an aging population, and so a higher number of people, therefore, getting diagnosed with cancer. This year, we're expected to have the most new cancer diagnosis in the United States than any other year in history. So let's put this together. We have increased new cancer diagnoses, improved survival rates, and a high utilizing patient population. Now, if I was a business person, if I was looking at this from purely a business standpoint, I would say, this is a great business model because I both get to tout success. I am succeeding in what I am achieving to do, and I'm getting a larger part of the market share. This is great. But when your business is the human condition, and when your outcome is life versus death, we have to think about that a lot differently. And again, this is where I would argue we have a lot of opportunities in cancer care. That said, all of these things combined lend themselves to increased healthcare system needs. What does this look like for a patient who is undergoing cancer care? Many of you know this as the people who are providing the direct care to patients who are receiving cancer care. But just again, providing some data and statistics, patients receiving chemotherapy have an average of 1 hospitalization and 2 ED visits per year. About half of those ED visits and 40% of admissions are directly related to treatment toxicities. Single center studies for patients receiving chemotherapy reveal 30-day readmission rates of 22 to 27% nationally, which is over double the otherwise general population and readmission rates in hospitals. And we know that these acute care episodes have several downsides, including reductions in quality of life, delays in treatment, increased risk of infections, increased healthcare costs, increased burden on caregivers, not to mention so many more. In addition to the personal impact, what about the financial impact and how this is affecting our patients? The overall cost of cancer is increasing drastically. There's kind of 4 big hitters when we think about high costs in healthcare: ortho, optho, cardiovascular, cancer. Traditionally, cancer was number 3 as far as overall costs, but the total cost of cancer is increasing at 3 times the rate of any of those other disease states. A lot of these costs are shifting to patients, so there are increased out-of-pocket costs and increased time-related costs. Cancer patients have a drastically increased likelihood to declare bankruptcy and an increased likelihood to cut spending on food, clothing, and other household basics. So once again, we've made progress. Patients are living for longer, but at what cost? And what are some of the overall effects of this? And so getting back to this, my original argument or claim that I make, the science has outpaced the system. What do I mean? Patients are living longer. That's wonderful. We're succeeding in certain ways. However, this experience is rife with financial toxicity, time toxicity, increased symptom burden, and widened healthcare disparities. And moreover, the people that this impacts the most are those with advanced cancer, i.e. those with terminal diagnoses, and under-resourced patients, minority populations, patients in rural communities, and lower socioeconomic status. So all of these are forms of suffering. So while we have prolonged life, we haven't paid enough attention to the suffering that's experienced by our patients that are receiving cancer care. Now that's a massive thing to undertake. Now, and today, what I have for you is one means that I believe addresses this gap, and that's our University of Colorado Care Clinic. Our University of Colorado Care Clinic, we're a multidisciplinary clinic dedicated to improving the quality, value, and experience of cancer care through proactive, patient-centered approaches to advanced symptom management and urgent care that's tailored to the unique needs of oncology patients. So again, we know that there is predictable suffering inherent in the experience of receiving cancer care. Our goal in the care clinic is to identify and intervene in these areas of predictable suffering in ways that can improve the overall experience for patients by reducing symptom burden, by reducing costs, by keeping patients out of the ED and out of the hospital. These are our goals. We do that by providing advanced symptom management and urgent care. Our capabilities, we can do IV intervention, including pain or nausea medications, fluids, electrolyte repletion, blood products. We can do a full lab analysis. We can do same-day imaging, including X-ray, ultrasound, CT, and MRI. And we've also added several unique and innovative programs, again, to align with the needs of our patients, including procedures, which I'll talk a little bit about today. So we're able to do paracenteses and thoracenteses in the care clinic. And we also provide a service of urgent palliative care. So for patients that have an acute clinical decline, again, you are the people caring for these patients. We know those scenarios where people haven't been amenable. We love to say early palliative care. But again, as patients live longer, and you tell me, I have 5 to 7 years, I really don't want to hear it until I'm at 5 to 7 years. Well, what's that resulting in? When those patients decline, we say, gosh, I'll put in a referral, and that referral wait time is 3 months, and those patients end up in the hospital, and often dying in a place that they ultimately didn't want to die. So we have to build systems to meet patients where they're at. As far as just some of the logistics, again, with the hope that people could take something home from this today as nurses that you can implement in your own institutions, because my dream is that this is a requirement in all cancer centers. We're open 7 days a week. Our staffing, we utilize hospital medicine APPs that are trained in oncology, as well as nurses that are trained in oncology, and several that have backgrounds in emergency room and intensive care settings. And we have our urgent palliative care clinic for a half day a week, and then we're able to do procedures 7 days a week, and this is in partnership with our hospital medicine colleagues. I'm not used to giving such a quick talk, and as you can imagine, I can be very verbose when it comes to the care clinic, so I'm going to try to move quickly and leave room for some questions. But just to give a little bit of to talk about our story and what have been our outcomes been. Our volumes have increased drastically. If you look at where we started in AY19, which is when I started in the care clinic, we have well over doubled the volumes in the care clinic. One thing I want to call out here is the procedures. Again, this isn't rocket science. If you live longer with lung cancer and patients with lung cancer have pleural effusions, we should build a system so that we can drain those effusions. That doesn't mean you need to go to the emergency department. We can do that, so we did that. And once again, we're on track this year to do over 660 procedures in the care clinic. This has been a tremendous benefit to our patients, and I think we've avoided not only a ton of ED visits and hospitalizations, but we've reduced suffering. We've offered patients the opportunity the same or the next day to say, I feel terrible, to provide an intervention that allows for relief. It's a really wonderful resource for our patients. Other outcomes. When we survey our own patients, 710 patients surveyed, 39% of patients say that if care clinic wasn't available, they would utilize the emergency department. So again, identifying preventable or prevented ED visits can be quite tricky, but this is straight from the horse's mouth. If patients tell us, if you weren't here, this is where I would go. So we know we're avoiding several ED visits. Similarly, several say they would go to their primary oncology clinic if we weren't available, but we know that they don't provide the same services. So we know we're really keeping patients out of the emergency department. In the care clinic, we've had a 50% decrease in 30-day ED visits since 2019, which we've sustained for the last 2 years. This is patients that have been seen in care clinic and their 30-day ED visit rate. And this one I find fascinating. Now, this is a low number, but when we look at care clinic visits versus an emergency department visit, same services rendered and same diagnoses. My disclaimer is the number on this is low. We looked at essentially 14 total patient visits, so 7 matched visits, matched diagnoses, matched services rendered in care clinic versus the ED. A care clinic visit, and this is what was billed to the insurance company. So what claim was submitted from the hospital to the insurance company? A care clinic visit was 33 to 50% the cost of an ED visit for same diagnoses, same services rendered. Find me an intervention in healthcare that saves 50 to 67%. In a patient population that is in the ED often, and that is going to be in the ED for several years longer because they're living longer. So there's tremendous benefit in this financially for the system. It's better for the patient, it's also better for the system. That's a wonderful thing. And moreover, and most importantly, what do patients say? When we survey our own patients, and we ask, how was your visit today? Well over 99% of our patients rate their visit as excellent or good. And some of the feedback that we get are things like patients saying, I'm so grateful this clinic is available, and it reinforced I'm not going through this alone. Care clinic is such a blessing. The thought of trying to figure out where to go for patients, for issues that occur with cancer is scary. Please keep this concept going. I can't say how thankful I am that this department was available when I desperately needed care. Please do more of this. Unbelievably outstanding care. I could never imagine this level of compassion, efficiency, responsiveness, and competence existed on this planet. I am so very grateful. Which one again, of course I have to go and nod to our incredible nurses, all who are here today, because these comments are often directed at them. Patients are really grateful to have these kinds of services available to them while they're going through a really, really hard time in their lives. Now that I've given the background on cancer care, again, I want to pass it over to our nurse leader, Rebecca Youngling, to talk about some of our strategies also to our strategies that have lended to our overall care clinic success for our staff. So.
Hi, I'm Rebecca. I'm excited to talk to you guys about Care Clinic. I'm really, really proud of it, as Kasey has. Like she said, we've grown exponentially over the last few years, more than anyone could have imagined, and have provided crucial care for all cancer patients. I'm here to share with you today some of the things we believe have contributed to our success. Recently, I heard a quote from Vincent van Gogh that reads, "Your profession is not what brings home your paycheck. Your profession is what you were put on this earth to do with such intensity that it becomes a spiritual calling." I believe this quote captures the way we all show up to Care Clinic to take care of the patients there. This graphic highlights how we lead synergistically to allow us to provide exceptional patient care. Transformational leadership, mission alignment, collaborative care, team cohesion, and holistic patient focus. Next slide. The following slides will discuss how these elements apply to Care Clinic. We have many nurse-driven projects, a lot of the things Kasey talked about. Everyone contributes to the success of Care Clinic. Nursing staff has been engaged in various ways and in projects that allow us to meet the needs of our complex patients in Care Clinic. We also have been supported by leadership that allows Kasey and I to take our ideas, which we have so many of, and run with them. Some of the examples Kasey already mentioned, but I will expand on some of them. We've created a workflow in which nurses meet with patients receiving anti-cancer treatment for the first time to introduce Care Clinic in our services. This has decreased cancer patients utilizing the emergency department, like she explained. Another way is we've teamed up with radiology to establish a process for Care Clinic patients to be prioritized for urgent same-day scans. Expanding the services we provide within Care Clinic. Additionally, in response to data collected on patients with increasing symptom burden who were frequently visiting Care Clinic, we established an urgent palliative care pathway to provide access to critical palliative care services and subsequently have decreased inpatient mortality. We collaborate as team members, and everyone is equally valued regardless of title. This includes interdisciplinary collaboration throughout the cancer center and hospital. The interdisciplinary collaboration we have allows us to provide holistic care to our patients. Next slide. Team building. We live by the idea that you need to take care of yourself so you can take care of others. We do this in a variety of ways, but this is what we've done and works for us. We encourage individual wellness, but we also look for ways to take care of each other. We go to Rockies games, we throw holiday parties, providers attend nursing meetings and vice versa. We have a very active department-based council that takes pride in advancing the work environment for both staff and patients. And finally, we review all the things people say about us in our Red Cap surveys. We celebrate and honor the good, but we also brainstorm any ways we can improve a patient's experience in Care Clinic. Next slide. Care Clinic is a desirable place to work. We believe this is because we are a true team. As I've mentioned before, there is constant collaboration. Kasey and I both staff Care Clinic and are involved in daily operations. By default, my desk is located in a bay within the clinic, but this has been positive because I'm engaged with staff and I can act as a resource. I come into work in scrubs and you'll often see me starting an IV or triaging on the phone. We believe staff stays in Care Clinic because there's variety to their work. They have complex patient care, but they also have the ability to triage. So if somebody has a bad day one day with patient care, the next day they can triage. MAs work at the top of their scope and are experts in their fields. Throughout the last few years of growth and change, we've prevented staff from feeling overwhelmed by allowing them to participate actively in that change. For example, the nurses and MAs were pivotal in the design and layout of our new space, permitting ownership and ensuring staff satisfaction. Lastly, we tried to build interdisciplinary teamwork and show appreciation for other departments that might collaborate with us. For example, we dropped off crumble cookies to radiology after they created a new workflow, and which provided excellent patient care. We've created an environment in which patients and staff can feel our positivity and passion in every interaction. We promote mutual respect, diversity of ideas, and the humanity behind patients. Often, we are supporting a human being during the toughest time in their lives, and remembering that is imperative. As previously mentioned, Care Clinic has come a long way. We've doubled our space and staff, and we don't plan on slowing down. But we've run out of time, so we're not going to tell you about all of our other ideas.
We really did have a slide that had our future directions and knew we would go over. But in conclusion, like Rebecca said, we really believe oncology, urgent, and acute care is a really important direction and area of growth for the future of cancer care, especially as patients live longer with a complicated disease where suffering is inherent to both the disease and the treatment. We think that these kinds of models are well built to help bridge that gap in the current healthcare system. We also believe that nursing leadership plays a pivotal role in identifying the gaps and building the models. Care Clinic was actually an inception of an infusion nurse's idea originally. Last, we strongly believe that caring for ourselves and for one another is the base, vitally important to sustainability and fulfillment and in a long and rewarding career in oncology care. We always will look to maintain this and improve upon this in Care Clinic. We're very accountable to our people, but we'll open things up for questions and feedback, and also open to speak with anybody offline if you ever want to reach out to us. So thank you.